Hey, Chris here again. I'm doing another video. Today my video is going to be on Ehler's Danlos Hypermobility Syndrome. So there are different types of Ehler's Danlos. The one that I have is hypermobility, so I'm going to talk about that one today. I have to put on my glasses. 38 with some pretty sweet reading glasses. Part of that is Ehler's Danlos, so it's a connective tissue disease. As your connective tissue breaks down, things like needing reading glasses at an early age are something you have to deal with. So EDS, or Ehlers-Danlos, it's on a scale. So it goes from joint hypermobility to full-on Ehlers-Danlos. They're basically the same thing, according to the International Consortium on Ehlers-Danlos syndromes. It's just a range. So right now I have a diagnosis of joint hypermobility. I see the geneticist in a few months. Hopefully we'll get locked down the Ehlers-Danlos because I do have a lot of symptoms. So the way that they diagnose this is originally off of the Baton scale. So this is a 9-point scale, and this has basically people doing things like seeing how far their thumb can go back. So most people will be able to make their thumb touch their hand. I can't do that. Part of that is I've had carpal tunnel in both my wrists, so I've lost a lot of my mobility. Retractions of muscles. So looking at your hamstrings, your ankles, the soles of your feet. So these are indicators that I all have for Ehlers-Danlos. Looking at family history. As of right now, there are no genetic tests for Ehlers-Danlos hypermobility type. For vascular type and other types, there are. They have some ideas of some things that might be able to prove it, but right now there's no definitive test as far as genetics goes. Twin studies do show that 36% of dizygotic twins will share in Ehlers-Danlos if one has it, and 60% for monozygotic. So there is definitely a genetic link. We just haven't quite found it yet. So some of the symptoms, there's a lot of symptoms. So these are the ones that I actually have, and then I'll go through some of the ones that I don't have and hopefully never have. So pain in joints and muscles. An example of this was when I was 8. I thought it was normal for kids to cry themselves to sleep because their back hurt so bad. I called it settling. I would lay down flat on my back, and then my back would hurt so bad that tears would come down my face, and I just thought that was normal, that everybody had back pain like that. So pain in joints and muscles, dislocations and subluxations. So the difference being a subluxation is like a partial dislocation. So an example of this is, for as long as I can remember, my toes would come out, and so they would come and sit right on top of the bone, incredibly painful, and I'd have to kind of work them back into place. Hypermobility. So some people are very, very hypermobile. So they can make their fingers do all sorts of things. Their elbows can go basically inside out, same with their knees, all sorts of things. I don't have as much hypermobility, and I never did as a kid either. But I do have hypermobility in ribs, in my neck, in my toes, my knees, elbows, a few other places. Skin tearing, stretchy skin. So when I was a kid, I used to like pull my ears way out and gross people out. It's kind of fun. Same with, I still have some stretchy skin, but that kind of tends to go away a little bit as we age. It's a little stretchy. Really soft skin. So my skin feels like baby bum soft, which is nice. And it also means that I don't wrinkle as much as most people would. So there's got to be some bonus to this. Easy bruising. So you can see, I recently had a hospital trip, yay, and they could not get the IV in either of my hands, and just trying leads to pretty excessive bruising. I've had bruises this big that can take, I'll have what's called bruise staining, so where it kind of leaves a yellowish tinge after for up to a year sometimes. Fatigue, so tiredness. Sprains. I currently have a sprained ankle as well as a fractured foot. Yay, super fun. atrophic scarring. So this was a recent cut that I got. So you can see it kind of spreads out. So that just means that when you cut yourself, your wound spreads instead of nicely knits together. Muscle spasms, poor healing, again, part of that. TMJ, so temporomandibular joint. So I've had TMJ issues since I was a teenager. Postural orthostatic tachycardic syndrome. I have another video that's on that. That is closely related. Preterm labor, both of my babies that I gave birth to. I have 3 kids, but I gave birth to 2. They came out early. Lots of complications with them too. Irritable bowel syndrome, which I have had. Flat feet. So I have orthotics. Orthotics are actually a really important part of preventing more damage, because if your feet are off, then your knees go, your hips go, and up it works its way. Eyes, sexy reading glasses. Constantly injuring yourself. So this is part of proprioception. So I don't necessarily know where my body is at all times. So I have a tendency, and always have, to walk into walls, to fall upstairs or downstairs sometimes, mostly upstairs though. So I don't necessarily know where my joints are, what they're doing at the time. So it leads to a lot of injuries. Tinnitus, or ringing in the ears. Cysts, I've had lots of ganglion cysts. Asthma, sexual discomfort, dental issues. So almost, I think I only have 1 tooth left that doesn't have a filling or a cap. Most of my teeth are slowly in the process of being capped. Part of this is clenching the teeth really, really hard. And part of this is also really fragile teeth. So as my dentist put it, he's been doing it for a very long time. He's been my dentist my whole life. When he normally does somebody's teeth, there's a certain feel to it. He said when he does my teeth, he has to be very careful. He has to be very tentative in how he drills and things like that, because they're very, very fragile and they just sort of break apart really easily. So I've broken many molars and all my teeth just by clenching my teeth or eating something. Eventually all my teeth will have root canals, and all of them will have caps on them. Just part of the process. And part of that is bruxism, so that's the jaw clenching, closely related to the TMJ. Varicose veins is another fun one, got some of those. Plantar fasciitis, so I have plantar fasciitis in my right foot. Dry eyes, hernias. I am currently waiting for surgery for an umbilical hernia. I call her Hermione. Sometimes she's kind of bitchy. Tendinitis, carpal tunnel. So I had carpal tunnel for the first time at 15. Probably should have been an indicator there. And then, so I have carpal tunnel in both of my wrists, both of my elbows. Carpal tunnel in both my wrists, tendinitis in my elbows and my right shoulder, and my right foot as well. I suspect a few more issues now. I just don't worry too much about it. And breathing issues while sleeping is another one. So some that I don't have and hopefully don't develop would be osteoarthritis, osteoporosis, mitral valve prolapse, aneurysm, Chiari, prolapse. So this can be prolapse of the bladder or prolapse of the uterus, gastritis, organ rupture. Lots of fun little symptoms there. So there, according to a study by Castori, this was an Italian study done, there's 3 phases. So there's the hypermobility phase, so this is the younger one. So this is where there's sprains, dislocations, a lot of growing pains. I had horrendous growing pains growing up, difficulty with writing, still have some difficulty with writing. If you're to look at my writing, it's pretty atrocious. Part of that is it's actually difficult for me to write. It's painful and it's messy and cramped, and yeah, it's fun. Coordination issues. So like I said, I was constantly hurting myself. I still constantly hurting myself. I pretty much always have bruises because I'm walking into things. So that's the first stage. So the second stage would be pain. So this would be chronic musculoskeletal pain, pelvic pain, gastro pain. This is also the stage where we see orthostatic intolerance. So this is the stage that I'm in right now. This would be typical for my age. I'm 38. Then we go into the stiffness phase. So this is reduction in function, reduced muscle mass, arthritis, defective proprioception. So knowing where your joints are. So even more walking into walls and fun things like that, except you're a little bit more fragile and stiff. So this doesn't mean that the pain stage or the hypermobility stage ends. It's just bringing you further into another stage as you age. This is where we'll typically see more things like the osteoarthritis and osteoporosis starting to take effect. It does affect your bone density, so it leads to more issues as time goes on. So this is a disease that affects women more than men. There is no total consensus. The highest sort of range they say is 9 to 1 women to men. We do know that it dramatically affects more women than men, but not in childhood. In childhood, it's 2 to 1 for women to men, or boys to girls. Girls to boys. The reason for that is we know that there's something that happens hormonally as women age that predisposes them to more pain disorders of all kinds, not necessarily just EDS. There's often a lot of overlapping diagnoses with other pain disorders. Again, women are just more prone to chronic pain disorders. So some of the things we'll see is chronic and acute pain in muscles, joints, connective tissue, and neuropathic pain, so nerve pain as well. The poor wound healing, we talked about that stuff. The chronic fatigue. Chronic fatigue can lead to impaired memory, anxiety, depression. There is an overlap there with POTS, or postural orthostatic tachycardic syndrome, and how that leads, to sleep issues as well. Hydration is key for POTS. Decrease in bone mass, an increase in osteoarthritis, the dental issues we talked about, premature births and gastro issues, increased risk of hemorrhage during birth. There is an overlap with mast cell activation disorder as well. So some of those symptoms would be flushing, hypotension, asthma, diarrhea, abdominal bloating, cramping, things like that. Something that they're looking at for me, we're not sure yet. Psychiatric. So depression, anxiety, low self-esteem, and negative thinking are all common with this through various stages. So therapy is something that is pretty important with this. So then that brings us to the management of it. Physical therapy is the only proven both preventative as well as curative, curative thing that you can do for EDS, hypermobility, because there is no way to reverse it. There's no way to stop it. Maybe one day, hopefully. Physical therapy is kind of where it's at. So this would be learning how to use your body appropriately and not hyperextend yourself. So a lot of people with hypermobility will have done like little party tricks and things like that and used their bodies in ways that are pretty damaging. So knowing how to use your body properly, knowing how to stretch. So I stretch 7 days a week. It takes about 40-ish minutes to do my stretches in a day. I also walk my dogs and do gentle exercise. So I use an exercise bike or ride a real bike outside, or do the rower. It has to be pretty gentle. You don't want to overuse. The ultimate exercise is swimming. Wish I had a swimming pool, that would be amazing. Swimming's a little harder to do on a regular daily basis. So keeping fit is actually really important. They used to say not to do physical exercise, so people would just like sit on the couch all day, but that actually leads to your joints locking up more and having more issues, muscle atrophy, all those kind of things. So obviously not ideal. So keeping active. Physical therapy, my physical therapy also includes needling. So acupuncture is very, very helpful, especially with things like swelling. Taking some supplements, natural vitamins, that kind of stuff can be helpful. That's different for each person, and depending on comorbid diagnoses. So some people have a lot of other things going on, like myself. So that is going to be individual for each person. Drinking lots of water, eating healthy is super important. Pacing yourself is really important. I struggle with this. So knowing when to take a break, when you need a nap, when you need to sit down, things like that. Education is key. So I have, this is my binder. This has papers that I have read on my various diagnoses, but there is a whole section for EDS with various different articles, medical research papers, that kind of thing, that I have found extremely useful. The more educated you are, the better off you're going to be. And you are the expert when it comes to doctors, right? I have multiple diagnoses, and my rheumatologist isn't going to understand what my endocrinologist is doing, and my hematologist isn't going to know what my endocrinologist is doing, all those kind of things. So for example, I have undefined bleeding disorder, which is also common with this sort of condition as well. When she was looking at prescribing me medications, I had to point out with my Addison's, I can't take this, I've got this going on, whatever. And she's like, oh yeah, you know, I forget. So you have to be the expert. So the better educated you are, the better. Things like heating pads are helpful, braces are helpful. So braces and splints. So this is actually a thumb splint, which looks pretty badass, I think. And this supports my thumbs because my thumbs have a tendency to hyperextend, and then they are very painful. So this just keeps them from doing things they shouldn't be doing, keeps them in good place. I have another one on order. I had to have it sized. So when I don't have that one, I also have these ones. So this would be for more support. So this would do the same thing as this, except this is much prettier. But this would give more support. So every single night, I actually sleep with this on my right wrist, because I have a tendency to tuck my thumb in, squeeze my hand like this, and then sleep on top of it, which is really damaging. So things like this, and these are amazing. So this is from Curves, and these just go over top so that all that stupid Velcro doesn't scratch you. So this just pops on over top. I won't actually pop it on. And that can be really helpful. When my issues are more related to the carpal tunnel, so my left wrist has been giving me a bit of problems lately, a more full splint would be helpful. And again, I've got a Curves one for this. And this one is a little fun. It is a zebra. So zebra is sort of the symbol for Ehler's Danlos. You know, the saying, when you hear hoofbeats, think horses, not zebras. In our case, think zebras. So I have a couple different kind of splints depending on that. This one is for my foot. And this keeps my plantar fasciitis from getting too bad. So basically it hyperextends my foot, my toes, pulls my toes up, so that my tendons are a little bit overstretched. So then when I step down, they're not already locked up, because if your foot's flat and I have a flat foot, then my tendons are already starting in this position. It's so much easier to injure myself. If they've already got some extra flex to them, I've got a little bit of room for the day to, you know, work with that. These are my Dawn Joys for my knees. So these ones have some joints in the side to help stabilize my knees, because my kneecaps like to go places they are not supposed to go and do stupid things and make my knees hurt like crazy and swell all up. I have these ones. I also have the ones that I'm currently wearing. These are well loved and worn, and you know, this whole trend of holey jeans is kind of helpful because it's easy to adjust them. You can see my air cast here as well in the puppies. And I just recently, hi boys, have a cane because crutches are not ideal for me with my foot because of my shoulder. Crutches would put my shoulder out too much, and then I'm dealing with a new issue. A cane is another option. I have just started using one a couple days ago. Yay, super fun. And then inserts in my shoes are super helpful as well. Whatever you can do to prevent damage is what you do. So dealing with fatigue is another really important thing when it comes to EDS. So this is through diet, having sleep studies done. Today I'm actually going to get my results from my sleep study. They suspect that I have sleep apnea. There are some facial features that happen with people who have EDS. So things like I have this gap, my top teeth go over. When they look inside my nose, they can see certain features, the shape of my face, things like that are all indicators that I'm more likely to have sleep apnea. I snore, those kind of things. So we'll see today, but that's a really important thing to look at. Psychiatric, so counseling to deal with chronic pain. I am in pain 24/7. It wakes me up. It's there when I'm awake. But I have come up with ways to deal with it. I don't take any pain medications. I won't take a Tylenol. I won't take an ibuprofen. I take 0 pain medications. I have my own ways, such as breathing, meditation, visualization, that I do to cope with my pain. Not everybody can do that, and I may not be able to do that forever. At some point I might need pain meds. I'm going to stave that off as long as humanly possible. So when it comes to pain management, non-steroidal things are best. I take steroids because I have Addison's, and so I am steroid dependent for life. I have to take steroids. The problem with steroids is if you go past a physiological dose, so a dose that your body would normally produce, you actually can cause significant problems with your connective tissue. And EDS being a connective tissue disease, they don't necessarily go well together. So it can speed up how fast you progress with your EDS. Muscle relaxants can be helpful. Things like opioids are rarely needed, but for some people they do need that. I have a really, really high pain tolerance, so I am quite lucky there. Care with surgery. So because we tear, our skin tears more easily, and we have poor wound healing and tend to have bleeding issues, we have to be very careful with things like surgery. And there's overlap with other disorders. So things like asthma is closely related. I also have asthma, POTS, undefined bleeding disorder. I have premature ovarian insufficiency. I have a video on that one as well. Addison's, I have a video on that. Raynaud's, I have a video on that one as well. And celiac, I will have a video on that. All of them are kind of interrelated. We know that EDS affects multiple systems. We just don't know exactly how it works and how it all kind of comes together, but that it does affect multiple systems, from our digestion to our joints. Anything that has connective tissue can be impacted by it. I hope that was informative and helpful for you. Thank you for taking the time to watch my video. Have a great day.